here specifically to answer questions on environmental health. So we have a stellar panel of experts to answer as many of your questions as we can get to in the time available. But first, as usual, I'm going to turn to Dr. Kasai to give some opening remarks and then a brief update on the COVID-19 situation in the region from Dr. Olawakure. So Dr. Kasai, first, over to you.
Thank you very much, Angela. Welcome to journalists across the region who are joining us on World Health Day. Each year on 7th April, we use World Health Day to highlight an issue on which we need to work to achieve better health. During the last 2 years of COVID-19, we have learned a lot, especially that when health is at risk, everything's at risk. Health and people's lives and the broader well-being of the society are inextricably linked. Our health and well-being are also closely linked with the planet's health. The UN Secretary General labeled the report of the Intergovernmental Panel on Climate Change, IPCC report, as a code red for humanity. It is also a code red for health, because climate change affects health in many different ways. And if we don't take action today, we are risking our health in the future. And that is why the theme of this year's World Health Day is Our Planet, Our Health, which highlights the interconnectedness between our own health and the health of our planet. There's no denying that climate change is one of the biggest crises facing humanity today. It is also a health crisis. Countries and areas in the regions, particularly Pacific Islands, are on the front lines. Changes in rainfall patterns, rising sea levels, and increasing frequency and severity of tropical storms threatens access to fresh water, reduce the lands suitable for growing healthy food, and increase the risk of waterborne, vector-borne, and foodborne diseases. Extreme weather events such as drought, heavy waves, typhoons, floods, and wildfires are affecting people's health in various parts of the region. And in addition to that, global warming consequence of burning fossil fuels, the air pollution it generates poses a huge direct threat to health. It is very clear. The time to act is now. There's no single big solution, but the governments, business, communities, and the individuals all have a responsibility to take actions to reduce climate change and environmental degradations, and thereby their impact on health. We must tackle this crisis together. The pandemic has also been a stark reminder of the importance of strong, resilient health systems. As we chart out way out of the current public health emergency, with the world's attention still on health, we in the health sector have an opportunity to contribute in two key areas. First, by building sustainable climate resilient health system, and second, by working with other sectors, using our voice to help strengthen the argument for broader actions to address climate change and environmental harm. While the health sector must contend with many of the problems caused by climate and environmental changes, it has relatively little control over the factors that cause these problems. Clearly, the sector outside of health are in the position to take the lead in reducing carbon emissions, but in the health sector, we can help them to understand or work together with them to understand that there are important co-benefits for health and for other sectors, and in doing so and in acting together. For example, building cities which promote active transport, encourage people to walk or cycle instead of driving, can lower air pollution with the benefits of respiratory and cardiovascular health. This would also result in higher levels of physical activities and helping to reduce the burden of non-communicable diseases. Now, in addition to these points about World Health Day, I also wanted to take the opportunity to take this opportunity of this press conference to provide an update of COVID-19. Let's begin with an overview of key numbers of the Western Pacific from our Director of Health Security Emergency, Dr. Babatunde Olobokure. Babatunde, please.
Thank you very much, Dr. Kasai. So I'm going to thank you, distinguished guests, members of the media, good morning. So I'll share with you the COVID-19 situation in the WHO Western Pacific region. If we go to the next slide, please. So the next slide gives you an overview of the global situation, and you will see that this is dated as of yesterday, and so the information is accurate up until then. Now, what we can see is that on the left-hand side, so those of you who are familiar with this presentation, you'll see on the left-hand side is the global picture, and each of those different colors represents a specific WHO region. And you will also see that what is the purple color, if you can see the purple color, which represents our region, is quite prominent towards the end, and I will touch upon that on the next slide. But on the right-hand side, you can see the various countries globally which are contributing the most to the upsurge in numbers that we are seeing. And this is driven mainly by Omicron across the world. And if we move to the next slide, please. So in the next slide, this focuses now or drills down into the Western Pacific region. And again, on the left-hand side, you can see the overall picture in our region. You can see that in the last several weeks, we have experienced a upsurge or an uptick in cases, which has been quite dramatic compared to our previous surges. And this is mainly because of the Omicron variant of the SARS-CoV-2 virus, which is much more highly transmissible than the previous variants that we have seen. And on the right-hand side, you can see the various countries which are in the top 10 within our region, and a number of those are experiencing those surges as a result of Omicron. Some are seeing a reduction in their surge now as they've gained more control and are being able to suppress transmission as a result of implementing a number of measures. And again, I will touch on those a little bit later. And we also have a number of our countries, of course, which you will not see on this particular slide. And those are the countries which are still yet to experience the encroachment of the virus in their country, and those countries are preparing to be ready to respond should the virus actually arrive when it does. So on the next slide, just give you an update for you on the key characteristics of the Omicron variant, which I'm sure most of you are familiar with by now, as this variant has been around for a little while. But if we go to the next slide, now the next slide talks about this recombinant forms of SARS-CoV-2 virus. And when we talk about recombination, what we're emphasizing is that there are two different virus strains which infect the same cell simultaneously and exchange genes between them. And so this exchange of genes may be similar in somewhat to mutation, but it is not unexpected given the level of transmission that we are witnessing across the region as well as globally. This is not unexpected, and we should really be maintaining our awareness and alertness for this to happen, and hence we are implementing a regional genome sequencing surveillance network. The next slide, so this slide shows you the surges that we will see are we should anticipate surges. And in order to do that, what we are seeing as well is that our member states are moving from what used to be a contain and suppress approach to SARS-CoV-2 to a suppress and live with it approach to SARS-CoV-2. This, of course, does not mean that we give up on maintaining our alertness and our awareness and our ability to continue to prepare and respond, because there is the potential, as we have seen already, for recombination, and a recombinant variant may be more severe than what we are currently dealing with. And so this is very, very important. And so any actions that we take now should improve our readiness to deal with what we are currently responding to, as well as to prepare for the future. And my last slide here is just a number of takeaway messages for you with regards to SARS-CoV-2 and our situation. So we will anticipate future surges, because this virus, as long as it is somewhere in the world, it will continue to mutate, it will continue to evolve, and it may continue to pose a threat to us. The recombinants that we have seen so far, variants that we are monitoring and continue to monitor, but currently there is no evidence of change compared to Omicron parent virus. And so therefore, any measures that we are currently taking are effective as far as we know at this time. Member states moving from this acute pandemic response to sustained management of COVID-19, they're required to use the 5 key tools which were illustrated in the previous slide, and also the 3 pillars as a package, and therefore look at ensuring system change and the system adaptability. And so as we move forward from these 2 phases into this new phase, the emphasis now should be continue to learn and improve so that our systems maintain their alertness, government preparedness for potential surges, vaccination. We need to prioritize vaccination, especially for those who are most vulnerable, those who are at the greatest risk of infection, and this includes the elderly, the immunocompromised, as well as healthcare workers and other frontline workers. And we also now need to ensure that individuals take particular responsibility, as well as owners of various settings. And when I say settings, I'm referring to schools, healthcare facilities, factories, and businesses. And so we all have a part to play in this. And so therefore, I would suggest that if we want to suppress transmission at this stage, we need to work together in order to be able to do that. Thank you very much. I'll be back to you.
Thank you very much, Babatunde. As you heard, some countries in our regions are now experiencing large Omicron drive surges, and others have passed their Omicrons, but continue to actively monitor and respond. And some Pacific Island countries and areas are dealing with their first community outbreaks, while others are still preparing for COVID's arrival. We know that the virus will not disappear soon, but we also know that working together, we can end this public health emergency. We have learned a lot over the past 2 years, including through Delta and Omicron surges, about how to protect the vulnerable, maintain the functioning of the health system, and adapt measures to enable societies and economies to function. Population-based measures are being eased in many places, but this does not mean countries are giving up on controlling COVID-19. Rather, it reflects that many countries are transitioning away from society-wide containment measures to an approach aimed at sustainably manage COVID-19 over the long term. We are able to do this because countries and areas in our region have used their response to Omicron to further develop and strengthen their system for suppressing transmissions of the virus. And we continue to learn from these experiences to improve and refine strategies for suppressing transmissions while resuming most normal social and economic activities. As a part of this approach, government, business, and communities and individuals all still have important and specific roles to play in contributing to the broader goal of suppressing transmission, especially to protect the vulnerable so that the societies can live with COVID-19. Now, government needs to go the last mile to reach every vulnerable persons with vaccines and refine the surveillance for the effective decision-making and ensure the health systems are arranged in a way to provide the services to those who need them and clearly communicate with business, communities, and individuals about what they need to know so that they can take most appropriate actions. And decision makers who are responsible for workplace, business, events, and other gatherings and schools need to take actions to keep people in those settings safe. And at this stage in the pandemic, it is just as important as ever that as individuals, we all keep making smart choices and take the right actions to help suppress transmission and protect the vulnerable people around us. This means, for example, getting vaccinated and boosted as soon as it's our turn, and wearing masks in high-risk settings or when with the vulnerable people around you, and physically distancing if necessary, and to manage the risk in our own context. If we all do this, we can control transmission, reducing opportunities for new and more dangerous variants to emerge, protecting the most vulnerable people around us, and get back to living the lives that we all want. Thank you very much. Back to Angela.
Thank you very much, Dr. Kasai and Dr. Olawakure. Let's dive straight into your questions. We'll get to as many of them as we can in the next 40 or so minutes. So the first question really follows on from the end of your remarks just then, Dr. Kasai. It's from Teresa Montemayor from the Philippines News Agency. And the question is, what conditions need to be met for WHO to officially declare the pandemic over? What will it take for these conditions to be met? We've had similar questions, a similar question from ABS-CBN News as well. Adi, over to you for that one, if that's okay.
Thank you very much for that question. As I mentioned, it is unlikely the virus will disappear anytime soon. It will continue to mutate and surge. So it is not the virus, but it is a system that can sustainably control the COVID-19 repeated surge while avoiding a significant disruptions to the society. Our member states has been responding to the current Omicron surge with the system built on what they have learned in the past 2 years. And we have been observing they're managing this surge without exceeding or reaching the red line. The red line is a point that the number of severe cases exceed the capacity of healthcare. There are multiple conditions contributing in this, including, for example, one, a high vaccine coverage, and then two, maintaining the basic public health measures, and then three, they're introducing now the mitigations measure in the high-risk setting, including schools, to protect the people in that setting so that they can continue to operate, and of course, continue to increase the healthcare capacity. And with these systems and the tools, and if that makes that also people confident, we can end public health emergency. And what is most important is continue to strengthen this system by learning and improve so that we can best respond to surge and mutations, but also we can be prepared for the next pandemic. Thank you very much.
Thank you very much, Dr. Kasai. Next question also from the Philippines News Agency, but with a similar question from Alison Jackson from AFP. Do you see a situation when people worldwide would need to have booster shots as a way of coping with the virus in an ongoing way? What does this mean for governments? I'm going to put that to Dr. Tran.
Thank you very much, Angela, and thank you for the question. So what we know now, the immunity from the primary series of COVID-19 vaccine decreased by the 4 months, and after that even more decreased after the 6 months. we know that the natural immunity from the COVID-19 infection does not last. And we also face the possibility of new variants arising, and we must be prepared for that. Given the waning protection for vaccination, we can foresee the booster dose being needed, especially for vulnerable groups, to prevent hospitalization, severe illness, and death. The booster dose are now part of vaccine rollout in most of the countries. In the Western Pacific region, 34 out of 37 countries and areas has introduced booster doses for priority groups, including healthcare workers, elderly, and as well as the general population. So as I mentioned, booster doses are important, especially for vulnerable and priority groups. But we also need to remember that there are many people, including the vulnerable population, like healthcare workers, elderly, and people with underlying condition has not received the initial primary series of vaccine. So we must stay focused on this and supporting countries to go to the last mile to reach those groups as the priority. So in order to go for the last mile, we should identify who are they, where are they living, and we need to pay extra efforts to reach them. So it is important to highlight the role of the strong and sustainable health system that can prepare for any eventuality. The government should ensure that they should sustain the structure that have been put in place to manage the pandemic in order to be ready for all scenario. Thank you so much. Back to you, Angela.
Thank you so much, Hong. Next question is on the theme of World Health Day. What is WHO doing to protect the most vulnerable from the effects of climate change, particularly in the Pacific? I'm going to put this one to you, Dr. Kasai.
Thank you very much, Angela. And thank you very much for that question. The Pacific Island countries have the smallest carbon footprint, but bear the biggest burden of the climate change. They're often described as being a front line of the climate change. There are many challenges for them, including limited resources to respond to this crisis. We take this very seriously. And we decided to include this health impact of the climate change and environmental health as one of the 4 thematic areas of our vision for the future, and put supporting the Pacific Island countries as a priority. The health sector can take actions in 2 domains. One is that what we can do within our health sector. And then the second is actually beyond the health sector, but we can contribute in urging the world to take actions and promoting the better understanding of the importance of the core benefit for health and in other sectors. During the Pacific Health Minister meeting organized 2 weeks ago, under the leadership of the Tuvalu Health Minister as a chair, they have discussed this issue. And they committed to transform their health system more sustainable, climate resilience, and the environmental friendly health system to be ready to have more frequent natural disasters, but also to contribute in reducing the carbon or greenhouse gas emissions. During the COVID-19, I have observed very strong solidarity and very strong partnership in the Pacific. And WHO is committed to work with those partners to support this effort. We also want to lift the voice of the Pacific to be heard. And we wanted to work with all the member states to contribute in advocacy around the importance of the climate change actions, with the evidence that how health will be affected from the climate change. Thank you very much.
Thank you very much, Dr. Kasai. Just a reminder for those journalists joining us online, if you have additional questions, just type them into the chat box in the Zoom meeting and we'll try to get to as many of your questions today as we can. Our next question is from Rafael Bassano from ABS-CBN News. The question is, how long should a country sustain a low risk level in terms of cases and healthcare utilization in order to be able to say that it has put COVID-19 transmission under control? In the case of the Philippines specifically, can we say transmission is under control? Babatunde, over to you for this one, please.
Thank you very much, Angela, and also to Raphael for the question. I think this is a very important question in terms of how we are going to move forward. When we look at the current situation in the Philippines, yes, we are seeing lower case numbers, but this does not mean that we should relax or we should not be vigilant. We need to remain vigilant. The virus, as we can see, continues to circulate globally and also within our region and within the Philippines. And as long as it does so, then we are still all at risk. And given that situation, we should therefore be prepared for occasional surges in cases to be seen, and also potentially deaths as well, which may occur, unfortunately. And this is because immunity wanes over time. So therefore, it is very important for us to, as has been said already, for people to be vaccinated, to receive their primary doses, and booster doses as appropriate and when available, but of course focusing on our priority groups. The way for us to approach and to be able to put transmission under control, as you have asked, is, as I mentioned earlier, with this the tools and that package, including the 3 pillars. And so if we implement those, improve our systems, as we have said, we have 2 years experience of dealing with SARS-CoV-2, as well as our recent responses to Omicron. And so learning from those, suppress transmission, protect the health system in order to sustain and maintain a functioning health system and economy. Thank you very much, Angela.
Thank you, Babatunde. Next question, back on the theme of World Health Day. It's from Logan Church with TV New Zealand. What can countries do to fight air pollution? What can all citizens do individually and collectively in this region? I'd like to ask Dr. Jacobs, joining us from Suva, to answer this question.
Okay, thanks, Angela. Kia ora, Logan. So the first thing to say is that, of course, there's already a huge impact on health from air pollution, particularly relating to lung disease and to cardiovascular disease. And that's right around the world, including in countries in our region. The first fundamental thing that's important for effective action to be able to be taken is that all countries need to understand their own air pollution situation, because, of course, the situation in one country will be completely different potentially to another country. So countries need to understand how bad air pollution is in their country. They need to understand which countries are most affected, which people are most exposed, and what are the main sources. And so with that knowledge, effective action is possible. So then to reduce air pollution, action across sectors is needed. So not just action in the health sector, but multi-sectoral action. So that includes things like policies and laws that target the major sources of air pollution in that country. So whether that's about cleaner transport or energy efficient homes or power generation, industrial sources of air pollution, agricultural burning, or better local waste management. The other thing that's important not to lose sight of is that often we only think about the air pollution outside, but just as important is air pollution inside our own homes and inside the buildings that we work in. And so, some of the things in some countries that'll be important for that will be things like using less polluting cooking methods, or for all countries, if people have to smoke, don't smoke inside. Now, communities also have a key role to play. But for communities to do that, they need good information. There needs to be good ongoing air quality monitoring. There needs to be regular public reporting from that monitoring, including warnings about periods of higher pollution, and advice on actions that families can take to protect their own health and also to reduce their own contribution to air pollution. So things like reducing their own private use of cars, not burning their household waste, not using solid fuel stoves, especially indoors, and not smoking, especially indoors. So thank you. Back to you, Angela.
Thanks very much, Mark. Next couple of questions are from Red Mendoza with the Manila Times. First question, is the WHO ready to call COVID-19 an endemic virus? What are the requirements for WHO to consider COVID-19 as endemic? We had a similar question from the Hong Kong China News Agency, and this one is for Babatunde.
Thank you very much. Thank you very much, Angela, and also to those who've asked this particular question. Currently we are in a pandemic situation, and if we then change the label to endemic, this does not change the challenge that we face. As long as the virus continues to circulate anywhere, there's still a risk of surges. There's still a risk, as I said earlier, of deaths occurring in the population. And so when we talk about endemic, endemic means lower circulation levels, but usually only refers to specific areas. And so therefore, even if the virus is endemic in those situations, it can still cause flare-ups, it can still cause surges, and it can still affect our vulnerable populations. So this means that even if it is a termed endemic, we still face a challenge, and we can still see that the virus remains dangerous and can cause severe illness and death. When we also have this type of situation where the virus continues to circulate for a long period, what we will see, and what we are also seeing currently, is what is termed long COVID. And with long COVID, up to 30% of people who are affected by COVID-19 have health problems which are long-term, and this affects people of all ages, and so therefore, again, for that reason, we cannot be complacent. The virus remains a challenge, and we therefore need to get sustained control, as I've mentioned earlier, which sustained transmission, and this will then help us to protect our populations and ensure that we can manage the situation. Thank you very much, Angela.
Thanks, Babatunde. Next question also from Red Mendoza, which is about vaccine supply. We've just had some similar questions from Neil Jerome Morales from Reuters. Different questions, but which I think go to the same issue. So we'll hopefully cover those off with the answer to this one. So the question is, some countries are experiencing a glut of vaccine supply, whether purchased or donated, and with some countries having problems convincing their citizens to take booster doses. Will WHO allow these countries to donate some of their vaccines to other countries who still need supply in order to reduce vaccine wastage? Over to you for this one, Dr. Tran.
Thank you very much, Angela. So there are two ways in which countries can share the vaccine with others. The first through bilateral arrangement between the two countries. The second should be through Kovacs, which can be facilitated by WHO and Kovacs partner, who then deploy vaccine to the countries who are most in need. Vaccine supplies and distribution are no longer the major issue in our region, although there are still no challenges in other parts of the world. There are some important considerations on dose sharing and redeployment of vaccine. There is a need for a strong system for good planning, coordination, logistic arrangement, and demand from the communities. And then the donated vaccines should have met the regulatory requirements and adequate shelf life to ensure the recipient countries will be able to use the donated vaccine effectively and safely. WHO is working closely with member states to carefully prepare for their plans and facilitate the dose sharing process to ensure that the countries are using vaccine effectively and avoid wastage of vaccine, and at the same time allow the recipient countries to have a sufficient time to utilize these donated vaccines. We have a good example of vaccine dose sharing in our region through bilateral and through Kovacs that shows a great solidarity and strong coordination among in our region. Thank you very much.
Thank you very much, Hong. Next question is from Richie Farrell from the Pacific Media Network. The question is about healthcare workers in particular. The burden of COVID-19 has fallen heavily on the health workforce, most of whom are not trained to respond to a pandemic of this magnitude. How can WHO help to build the workforce and better prepare specific countries? Obviously, this is a question that has relevance beyond the Pacific, but because it is from the Pacific, I'm going to put it to Dr. Jacobs. Mark, over to you.
Yeah, thanks again, Angela, and thank you for the question. So strengthening capacity of the health system and the health workforce has, of course, been a big focus for WHO, not just during the pandemic, but before COVID, and also thinking beyond COVID. And of course, that work isn't just about training. Training is an important part of that, but it goes well beyond just thinking about training. So during COVID, the focus has been really on helping countries ensure that their workforce has got the knowledge they need, the skills they need, the systems they need, the tools they need, and the equipment they need to provide quality, accessible, and safe care. And there's been not only a lot of work being done on this by WHO with countries, but a lot of support from partners around the region and around the world for that work. So strengthening this capacity in countries, of course, isn't just important for the COVID response. It also strengthens the health system and the health workforce more broadly. And that is going to benefit the care that they're providing and will provide on a whole range of health issues into the future. And one of the key ways that we'll do this together is taking a learn and improve approach to our work. So working with countries on this will keep being central to WHO's work in the Pacific and across the broader region. So thank you, and back to you, Angela.
Thanks very much, Mark. Next question is from Sophia Tomacruz with Rappler. We've had similar questions from CNN Philippines and GMA News about Omicron XE. We know there's a lot of interest in this topic. Can you tell us more about Omicron XE and what is known so far? How does WHO assess its possible impact on the landscape of the pandemic? Are there specific interventions countries should be taking or outcomes that they should be anticipating? This one is for you, Babatunde.
Recombinants will emerge. Recombination, as I said earlier in my presentation, occurs when at least two different viral strains infect the same cell and exchange genes between them. WHO is tracking recombinant variants, including those of Delta and Omicron, which give us the XD lineage, and the Omicron sublineages BA.1 and BA.2, which include the XE lineage. So recombination is common among coronaviruses and is expected. And so therefore, we should really anticipate that these recombinations will happen and prepare our systems accordingly. The XD is being tracked, and the XC is also being tracked as well. And so therefore we continue to monitor those and how they are developing and spreading, particularly in terms of whether they are more transmissible or not. Currently, our available evidence suggests that they are not more transmissible than the Omicron parent. We need to continue to assess the public health risk which is associated with these recombinant variants, because they have the potential, as I said earlier, to provide us with a greater challenge, as they could be more severe. They could result in a recombinant variant which evades our use of vaccines and other measures. And so therefore, we need to be vigilant, we need to continue testing, and we need to continue to identify any unusual events, any surges as quickly as possible, and share that information so that we can end this phase of the pandemic. Thank you very much, Angela. Back to you.
Thanks very much, Babatunde. Next question is from Peter Blaser with Reuters, and we've had similar questions from Marianne Benitz from The Standard in Hong Kong, and as well as the Hong Kong China News Agency. And the question is about China. What does WHO think about China's very strict containment policy that focuses on the total number of infections and isolating all cases, including asymptomatic people, while the rest of the world largely focuses on severe cases and reducing deaths? I'm going to put this one to Dr. Kasai.
Thank you very much for that question. China's very strong measure have kept the number of deaths low, and then they're minimizing the social disruptions in the country. And I would like to point out that with the huge populations of the China, even the proportion of infections is low, that may potentially overwhelm the healthcare facility. That said, the human and social cost of lockdowns are considerable. And our thought is with the people and the healthcare worker participating in this lockdown in Shanghai, Jilin, and also other places currently experiencing this. In this region, we have been learning a lot in the past 2 years about the virus and how to respond to this pandemic. And the member states have been adjusting their response according to those new knowledges. And we have seen some recent changes in China. For example, revising their healthcare pathway and utilizations use of the antiviral drugs and then the rapid antigen test. The situations of each country is different. And every country's strategy needs to be according to their context and then the assessment of the risk. Like all other countries, I'm sure that China would continue to do their assessment of the risk and then adapt their response according to the appropriately to the according to the context going forward. Thank you very much.
Thank you very much, Dr. Kasai. Next questions back on the topic of vaccines from Caroline Bonquin from CNN Philippines. The question is, the Philippines plans to donate vaccines from the Kovacs facility to other countries. Officials have said that they are yet to seek Kovacs guidelines on this. At what point will this be allowed? Which countries in the region still need more supply? Over to you for this one, please, Dr. Tran.
Thank you very much, Angela, and thank you very much for the question. So the redeployment of Kovacs supply vaccine is possible and is welcome to support other countries where vaccine is are most in need. The redeployment need to follow the certain procedures and criteria for vaccine redeployment, such as the vaccine expiry date, the quality of vaccine, and the regulatory requirement. And there are following consideration need to be taken into account. That the first one is the time lead between the expiry date of the vaccine that need to be redeployed until it can reach the shore of the recipient countries to ensure that the receiving country will need to have sufficient time to roll out the vaccine. And the quality and the integrity of the vaccine must be also assured. And the vaccine should be certified to have met all the requirement of regulatory authorities. So WHO and Kovacs are working closely with the countries to plan for this process, and we would like to ensure that the dose sharing and redeployment of vaccines should be taken into a very careful consideration to ensure that the vaccine will be reached to the countries that can be used effectively and safely. Thank you so much.
Thank you very much, Wong. Next question is from Lei Alviz with GMA News. The question is about the Philippines. With the massive campaign rallies here in the Philippines in the lead up to the elections, is a surge of COVID cases likely in the coming months? Babatunde, over to you for this one, please.
Thanks very much, Angela, and also thanks to Lei for the question. Again, I would like to emphasize that as long as the virus is circulating anywhere, then there is always a risk for a surge in cases to occur. And so it's very important that our communities everywhere do not get complacent and with the major activities coming up, including religious events and elections in the Philippines and elsewhere in the region, we really need to be prepared to see surges occurring, and also for ourselves, individuals as well as owners of these events, to really prepare and ensure that they take measures to suppress transmission. Our experience over the past 2 years of dealing with Omicron as well as Delta has shown, both in the Philippines and elsewhere, that these mass gathering events are likely to increase the risk of transmission. And so individuals, they need to, if they're going to attend these events, they need to make smart choices and they need to take the right actions appropriate for each context. And so, again, the emphasis, ensure that people are vaccinated and boosted as soon as it's their turn, physical distancing if necessary or where possible and appropriate, and wearing a mask in higher settings or when with vulnerable people. And I would just like to emphasize about masks if I can. And so results from numerous studies as well as our experience has shown that when you use the appropriate mask and you wear it properly, covering your nose as well as your chin, that it's very effective in reducing the risk of transmission of SARS-CoV-2 to others. And so therefore, when you wear your mask, you're really providing protection for other people. And so whenever you're in a gathering and you're wearing masks, you're protecting each other. And so the cumulative effect of that helps us to suppress transmission. And so therefore, this shows that all of us have a responsibility to make the right decisions based on the setting in which we are intending to go to. Thank you very much, Angela.
Thank you very much, Babatunde, but don't relax because I'm about to come back to you with another question on variants, this time from Judy Kwan from the Hong Kong China News Agency. Apart from the known variants, what other variants of COVID-19 do we anticipate in the future? What will be the direction of the mutations? Will they become more or less virulent? And how about infectivity? Babatunde, back to you.
Thanks very much, Angela. Thanks very much to Judy for that very important question. So emphasis again is on continued circulation of this virus. As long as this virus continues to circulate, we are still at risk. And again, as long as the virus continues to circulate, it can evolve, it can mutate, and it can then throw up variants of concern, which may be more severe or maybe more transmissible or may evade therapeutic measures, measures such as vaccines or any available drugs. But it's not certain in which direction any new variants will go. And so therefore, this is the reason why WHO continues to work together with countries and partners to monitor these variants and what impacts they have on the health of the population, as well as on our health systems and services. And again, why we emphasize the use of vaccination and ensuring our priority groups are vaccinated, particularly those who are most vulnerable and those who are in hard to reach areas. So all of this has been gained from our 2 years of experience of responding to COVID-19. And so therefore the keys, the tools that we have been developed into a system, and that system continues to learn and improve as we respond to the variants of concern that do arise, as well as the way in which we continue to track and assess new variants that may have implications for public health measures. Thank you very much, Angela.
Babatunde. Next question from Alison Jackson from AFP. Also for Babatunde, should countries tighten domestic restrictions or border controls in response to the BA2 variant, or is this variant mild enough that countries don't need to worry? We had a different set of questions from the Pacific Media Network, but which really go to the same issue about how countries should manage resurgences and the risk of future waves. So Babatunde, could you respond to these ones, please?
Thank you very much, Angela, and thanks to those who've asked this particular question. And so when domestic restrictions or border controls are put in place in response to any virus, taking SARS-CoV-2 now as a particular virus, it buys time for us to prepare our systems to be able to respond. However, of course, that variant may at some stage enter the country. And so the most important thing that we can do, because this virus is not going anywhere, it's going to be with us for a while, and so therefore we need to anticipate those surges, which may be attributable to this BA.2 or to any other variant, is that we need to have those systems in place which can respond to any importation of the virus. And what we emphasize again is vaccination coverage, that we should vaccinate those or prioritize vaccination to those who are at greatest risk, and as well as our most vulnerable. And so in that way, we can protect them, but it's not vaccination alone. We should also ensure that our public health and social measures that we use and that we know work, such as the use of masks, hand washing, and physical distancing, that those are also implemented, but they can be adjusted in terms of what the current situation is. And so therefore, enabling people to make those individual choices within within guidance that is given by government to ensure their safety as well as the safety of others. Thank you very much, Angela.
Thanks, Babatunde. We're fast coming up to the top of the hour, but we're going to try to get through a few more questions. Babatunde, you spoke on masks before, but we have another question from Wenshika Kumar from the Fiji Times, also about masks. With regard to Fiji, mask wearing has become optional and most of the COVID restrictions have been removed. Is this safe? Anything to add to your previous responses which cover masks? We also had a similar question from the Manila Times.
Thanks very much, Angela, and also to Wanshika as well for the question. And so this, I think, is a very important question for every country. So many countries now are easing their population-based measures, including masks as well. And I've said previously that this really, wearing a mask is really a public health social measure which is protective for other people. And this easing of these restrictions actually reflects the movement from society-wide containment measures to sustained management over long term. And as I said in my presentation, that sustained management over the long term will require a lot of individual choices and making smart choices based on their individual risk assessment. And so what we are looking for is that individuals, decision makers responsible for workplaces, businesses, events, and other gatherings, and schools need to take action to keep people in those environments and those settings safe. And when we talk about this, this is not just about Fiji, it's for every country. And we need to keep making those right smart choices and taking those right actions in order to manage risk for ourselves and for others. And so therefore, vaccination, mask wearing, physical distancing, as well as hand washing, very, very important, and I think cannot be emphasized too much. Thank you very much, Angela.
Thanks, Babatunde. Next question is from Gurley Lanau from the Deutsche Press Agency, and it is back on vaccines, specifically vaccine coverage in the region. How would we describe vaccination coverage in the region right now? Is it enough to protect the region from a new wave of new variants? And is vaccine equity still a concern? Dr. Tran, back to you for this one.
Thank you very much, Angela, and thank you for the question. So despite the equity challenges that are happening in other parts of the world, the vaccine supply and distribution are no longer the major issue in our regions. Most countries and areas in our region, including low-middle income countries and Pacific Island countries, are now in relatively good position on vaccine accessibility and availability. As I mentioned in my previous response, WHO has set up a close coordination mechanism with Kovacs and donor countries to facilitate the supply of vaccine in our region. Our goal of vaccination to prevent severe illness, hospitalization, and death due to COVID. To achieve this goal, it is essential to protect the vulnerable population. So for this reason, WHO is encouraging countries to measure the coverage of the most vulnerable groups. So our region have now vaccinated a high proportion for the most vulnerable and broader eligible populations. Almost all the countries and areas, 36 out of 37 countries and areas in our region have a fully vaccinated for healthcare workers, and 23 out of 37 countries and areas have a fully vaccinated for the elderly. So we are aiming at achieving 100% of coverage for elderly population and other vulnerable groups in our region. So looking broader at global level, sadly, there are still the major equity issues that, for example, in 23 African countries, only 1 in 4 elderly people have received a full course of vaccine. So we must ensure that people everywhere to receive their primary vaccine doses, and also we pay particular focus on reaching the most vulnerable groups and achieve the last mile in vaccination. Thank you very much.
Thanks very much, Dr. Tran. We are almost out of time, but we want to squeeze in one last question, and it's back on the theme of World Health Day, specifically focusing on climate change. The question is from Nina Bandari from SciDev. What are the main hurdles in achieving climate change targets, despite the urgency? Are governments in the region recognizing that climate change is the single biggest threat to the planet and to health, or is politics stymieing progress towards reducing climate change? I'm going to throw back to Dr. Jacobs, our climate change lead on this one. Mark, over to you.
Okay, thanks, Angela, and thank you for the question, Nina. Just briefly, I think for me, the fundamental challenge is how to move beyond the rhetoric and towards actual practical action. And I think key to that is understanding and feeling that action isn't just needed, but action is also possible. And also added to that, that we don't just need to optimistically wait for someone else to come up with a big solution to this. We can and should all be taking our own steps to reduce our own contribution to climate change as individuals, as families, as communities, and as countries. And having taken one step, take another, then another, and then another today and tomorrow and into the future. So thank you.
Thanks very much, Mark. Couldn't think of a better note to end a World Health Day press conference focused on climate change with, so thank you very much for that. We are out of time. I hope we've been able to cover most of your questions. If we haven't, if there are still burning questions that you don't have an answer to, please reach out to the team here and we'll do our best to get back to you. You are also all welcome to join us for our online World Health Day event starting in exactly 1 hour from now. I think you've all received the connection details for that. If you haven't got them, please again reach out to the team here and we'll shoot them over to you right away. Thank you so much for being here. Thanks for sending in all your questions. It's always a pleasure to see you all online. Happy World Health Day and see you next time. Thanks very much.